Good day everyone, we are the Group A Pipe and today we will be discussing an important topic in the medical field, hypovolemic shock. But before we begin, let us first introduce the member of the group. First, we have the Miss Lacamento. Second, we have Miss Lago. Third, we have Mr. Mama. Fourth, we have Miss Mamalak. And the last one is Miss Mandaragon. In our presentation, we will be cover the causes, signs and symptoms, medical manifestation, and etc. We hope that our discussion will be informative and meaningful for everyone. Our general objective is to enhance an understanding of the hypovolemic by exploring its definition, causes, clinical manifestation, laboratory and diagnostic findings, treatment option, and nursing intervention for effective patient management. What is hypovolemic shock? Hypovolemic shock happens when the body loses a large amount of blood or fluid leading to drop in blood volume. Because of this, the heart cannot pump enough blood supply oxygen to the organs. So, loss of blood or fluids, less blood return to the heart. Heart pumps out less blood. Body organs don't get enough oxygen. Causes of hypovolemic shock. Hypovolemic shock happens when the body loses a large amount of blood or fluids. This can occur due to number 1, blood loss. It is hemorrhagic from an external injury, surgery, trauma, or internal bleeding. Second, we have the fluid loss, non-hemorrhagic, from severe diarrhea, vomiting, excessive sweating, or burns, where the bloods leak into the abdomen. In all cases, the result is the same.
So now, we will be discussing the clinical manifestations of hypovolemic shock. Basically, clinical manifestations are the signs and symptoms that we can observe in a patient when their circulating blood volume drops. When this happens, the body will try to compensate first. Compensate means that the body is making adjustments to keep the important organs like the brain and the heart supplied with blood and oxygen, kahit na kulang na yung volume. But if this continues and the body cannot keep up, it will decompensate, meaning adjustment failed and the patient's condition gets worse. Now, let's go through the manifestations one by one. First is hypotension. If we are experiencing a big drop blood pressure, it means that the heart doesn't enough volume to pump. That's why patients with hypovolemic shock often look weak. And next is tachycardia. If our blood pressure is low, the heart will try to beat faster to make it up for it. That's why patients have a very rapid heartbeat because the body is trying to circulate whatever the blood is left. Next is tachypnea. If oxygen delivery is not enough, the body tells us to breathe faster, so the patient starts breathing rapidly to bring in more oxygen. Delayed capillary refill. If we press the nail bed, the color comes back very slowly. This shows the circulation to the extremities is very poor. Next is altered mental status. If the brain doesn't get enough blood and oxygen, the patient can become confused, restless, or even drowsy. Next is anxiety or agitation. If we experience not enough blood flow, we often feel nervous or uneasy. The patient may look anxious because the body senses something is wrong. And the last is weak or thready pulse. If there's not enough blood being pumped out, the pulse becomes very weak and hard to feel. So in short, the body first tries to fight back by increasing the heart rate and breathing. That's compensation. But if the volume loss continues, the blood pressure drops, pulses, weaken, and the brain is affected, that's decompensation. So, recognizing this progression is very important because it allows us as future nurses to detect hypovolemic shock early and take immediate action before condition becomes life-threatening.
Para naman sa laboratory and diagnostic findings na hypovolemic shock, kailangan natin ito dahil hindi sapat na physical signs lang ang mga test na nagko-confirm ng ating diagnosis. Tumutulong ito upang makita kung anong cause ng fluid or blood loss at sinacheck din kung may naapektuhan na organs gaya ng mga kidneys at heart. Bukod doon, sila rin ang nag-guide sa ating treatment kung kailangan natin ng blood transfusion, fluid replacement, or surgery kapag may internal bleeding. Para sa laboratory findings, meron tayong ditong hematocrit, bumababa ito kapag may hemorrhage or pagdurugo. Next naman ang ating BUN or creatinine ratio, mataas, ibig sabihin may problema sa kidney function dahil kulang ang dugo. Pangatlo ay ang ating urine sodium, mababa kasi nagtitipid ang kidneys ng sodium. Pang-apat ay ang ating serum lactate, mataas, ibig sabihin sign na hindi sapat ang oxygen na nakakarating sa ating tissues. Pang-lima ang ating electrolytes, nagkakaroon ng imbalances depende kung may diarrhea or pagsusuka. Pang-anim ay ang ating CBC, para makita kung gaano kalaki ang blood loss at kung may anemia. Next naman ang ating blood type and cross-match, kailangan ng blood transfusion. At ang panghuli sa laboratory findings ay ang ating coagulation test, chinecheck ito kung may maayos tayo na clotting ng dugo. Para naman sa diagnostic findings, una ang ating physical exam, makikita ang low blood pressure, mabilis na heart rate, malamig at clammy ang balat, konting ihi at signs ng dehydration. Pangalawa, yung ating orthostatic hypotension. Ito ay bigla pagbaba ng ating BP kapag tayo ay tumatayo. Pangatlo naman ay ating urine output, mababa, kadalasan less than 30 ml per hour. Pang-apat naman ay ating imaging tulad ng ultrasound, CT scan or MRI para makita kung saan ang internal bleeding. Next naman yung ating echocardiogram para malaman kung gaano ka-epektibo ang ating pagpump ng dugo or ang pagpump ng ating puso. At panghuli ang ating endoscopy para makita kung may bleeding sa tiyan or GI tract.
So, for medical and or surgical treatment for hypovolemic shock patients, so once a patient is brought to the hospital, the first step is rapid replacement of fluids through an IV, usually with normal saline or reduced lactate. So, if blood loss is severe, blood transfusion is also given to restore oxygen carrying capacity. At the same time, it is very important to treat the underlying cause such as stopping the bleeding or replacing fluids lost from burns or diarrhea. So if fluids and blood replacement are not enough to stabilize the patient, medications called vasopressors and inotropes are used. These include epinephrine, norepinephrine, dopamine, and dobutamine. They work by tightening blood vessels and strengthening heart contractions, which help maintain blood pressure and circulation. Patients with hypovolemic shock require close observation in the intensive care unit. So continuous monitoring allows quick intervention if complications occur such as arrhythmias or further drops in blood pressure. So the treatment of hypovolemic shock focuses on three main goals. First is rapid fluid and blood replacement. Second is the use of medications if needed. Number 3 is fixing the underlying cause. So with prompt and appropriate treatment, survival chances greatly improve.
So the nursing interventions for hypovolemic shock, first is the immediate assessment and stabilization. Check the airway, breathing, and circulation immediately, then administer oxygen and ensure a patient airway. For vital signs, monitor heart rate, blood pressure, respiratory rate, and oxygen saturation every 15 minutes. And note a classic sign is a fast heart rate with low blood pressure. Then assess consciousness, check for changes in mental status such as restlessness or confusion which indicate poor brain perfusion. For fluid resuscitation, insert 2 large bore IV catheter, 14 to 18 gauge for rapid fluid administration. Then give isotonic crystalloid, like for example is the normal saline as prescribed to replace lost blood volume. If the cause is bleeding, administer packed red blood cells and other blood product as ordered. Then ongoing monitoring, accurately track all fluid intake and output, including urine output which should be at least 30 ml per hour. Then prepare for assist with placing an arterial line or central venous catheter to get real blood pressure and fluid status. Then monitor lab results for hemoglobin and hematocrit level and lactate level, as decreasing lactate level shows that interventions are working. Patient safety and comfort, if bleeding is visible, we can apply direct pressure. For positioning, elevate the patient's leg to increase venous return, then maintain the patient's body temperature as hypothermia can worsen shock.